You're here for the deep dive because, well, you want to quickly get a real handle on something complex. Forget the fluff. We're going straight to the core.
Mm-hmm.
Today, we're tackling canine house soiling. That really frustrating issue so many dog owners face. We're going to unpack what it is, the real reasons behind it, and what actually works to fix it.
Exactly. And we've looked closely at some professional veterinary resources. They outline the causes, how to figure out what's going on, and the different ways to address this common issue.
Right.
So think of this as your fast track to understanding why your dog might be eliminating indoors and, more importantly, what you can actually do about it.
So your mission, should you choose to continue listening, and clearly you have, is to finish this conversation with a solid understanding, moving beyond just, frustration to knowing what steps you can take.
Yeah.
Okay, let's unpack this. So in simple terms, what exactly is canine house soiling?
Well, essentially, house soiling is when a dog urinates or defecates in places that we as owners don't want them to, like inside the house.
Okay, simple enough.
But there's a key distinction to make right away. Is it about needing to relieve themselves, elimination? Or is it territorial marking? They're driven by different things.
Right, okay. So it's not always just a simple gotta go situation. That marking thing feels important. Why? Why do they do that?
Territorial marking is basically a dog's way of communicating their presence, like leaving a little scent message, It can be influenced by hormones, that's why it's more common in intact males, but also by feelings of anxiety or a need to kind of secure their territory.
Okay.
And the impact of house soiling overall, it's really significant. Did you know that almost 20% of dogs given up to animal shelters are there because of this exact issue?
Wow, 20%, 1 in 5. That really hits home how big of a problem this is for owners and, well, sadly for the dogs too.
Yeah.
It's definitely more than just an inconvenience, isn't it?
Absolutely. In fact, the source mentioned that 37% of owners who talk to their vets about dog behavior actually bring up house soiling as a concern.
37%, that's a lot.
It is. And it's also a common reason why vets refer cases to behavior specialists. That tells you it's often not a simple fix.
Right.
And what's quite striking is that intact male dogs show a much higher rate, almost 60% of inappropriate elimination, which includes marking, compared to, say, neutered males or females.
60%, that's a massive difference. So, okay, let's dig into why this happens. What are the behavioral reasons a dog might decide the living room carpet is the perfect spot? Let's start with the basics.
Okay, well, the most straightforward behavioral reason, especially with younger dogs, is simply that they haven't fully grasped the concept yet. Where they're supposed to go, their house training might just be incomplete. Then you have things like submissive or excitement urination. Again, we see that more in puppies and adolescent dogs.
Yeah, that little squirt when you walk in the door.
Exactly. That's often linked to them feeling a bit overwhelmed or maybe showing appeasement. It's not necessarily defiance.
Ah, okay.
Yeah.
So that little puddle of excitement isn't always a sign they need more potty breaks then.
Precisely. It's more about their emotional state in that specific moment. Then there's territorial marking, which, like we touched on, is often hormone-driven, especially testosterone.
Right.
It's a way of saying, this is mine. But it can also be triggered by feeling insecure or anxious about their territory.
Yeah.
Beyond those, we also see house soiling connected to other behavioral issues. Things like separation anxiety, the stress of being left alone can manifest in, well, lots of ways, including this.
Makes sense.
Noise phobias, too. Cognitive decline in older dogs, kind of like doggy dementia, fear responses to certain situations, and even a condition where psychological factors lead to excessive drinking and therefore excessive urination. It's called psychogenic polydipsia polyuria.
Wow.
So yeah, it's a pretty complex picture.
It really sounds like a puzzle to figure out. And I think I remember reading that where a dog comes from might play a role too.
That's an interesting point, yeah. The research suggests dogs from large-scale commercial breeding facilities, puppy mills, essentially seem to be more prone to urinating on objects and showing that submissive urination compared to dogs maybe from smaller, non-commercial breeders.
Ah, why is that?
Well, the exact reasons are still being studied, but it likely relates to differences in their early socialization, their environment during those critical developmental periods.
Okay.
And as for urine marking specifically, that behavior tends to pop up around the time a dog hits sexual maturity, which, again, points to the influence of hormones.
Okay, that gives us a good handle on the behavioral side.
Yeah.
But the veterinary resource we looked at really stressed considering medical causes too. Why is that so vital?
Oh, it's absolutely crucial because a medical condition could be the primary reason for the house soiling, or it could be making an existing behavioral issue worse.
Right.
If we ignore a potential medical problem, we're just delaying the right treatment and, prolonging the issue for the dog and the owner. And a whole range of health problems affecting different body systems can lead to changes in elimination habits. Like degenerative conditions, think osteoarthritis. If it hurts to get up and move, accidents are more likely.
Makes perfect sense. Painful to posture or get outside quickly.
Exactly. Or kidney failure when the kidneys aren't filtering properly that can lead to increased urine production and less bladder control.
Okay. What are some other medical examples?
Well, you can have anatomical problems like something called ectopic ureters. That's where the tubes carrying urine from the kidneys don't connect to the bladder correctly, causing constant dribbling.
Oh, wow.
Then there are metabolic diseases, actual incontinence itself. Diabetes mellitus and diabetes insipidus both make dogs really thirsty, so they drink more and pee more. Liver problems, hepatic insufficiency, hormonal imbalances like Cushing's disease or Addison's disease. Even seizures can sometimes cause a temporary loss of bladder control. It's a broad spectrum.
That is quite a list. It really underscores why you can't just jump to assuming it's behavior.
Exactly right. And the list keeps going. Growths or tumors, neoplastic conditions in the urinary tract or even in the brain or spinal cord affecting control. Other cancers causing general weakness.
Gosh.
And then infectious or inflammatory conditions. Things like urinary tract infections, UTIs are pretty common. Bladder inflammation, cystitis, sometimes linked to crystals in the urine. Even things affecting the gut, like inflammatory bowel disease, pancreatic issues, or intestinal parasites can disrupt normal elimination.
So, okay, with all these potential medical and behavioral factors flying around,
Yeah.
how does a vet or a behaviorist actually figure out what's going on? What's the diagnostic process like?
Well, the very first step always is a thorough medical workup by a veterinarian. This usually means blood tests, a CBC and biochemistry profile, and a urine test, a urinalysis. Yeah, but essential to rule out or identify any of those underlying medical conditions we just talked about.
And if those medical tests come back normal, does that automatically mean it's behavioral?
Often, yes, it points strongly in that direction. But there's a little wrinkle. It's possible a dog had a medical issue, say a UTI, that got treated and resolved, but the experience kind of led to a learned habit of going indoors.
Ah, like the habit stuck around even after the medical issue was gone.
Exactly. So even with clear medical results now, a behavioral component might still be playing a big part.
Okay. So how do you diagnose the behavioral side then?
Well, there are specific things we look at. Video recording how the owner and dog interact can give really valuable clues about triggers and patterns. Owners are often asked to keep a detailed diary or journal, noting when, where, how often it happens, what else was going on at the time.
Like detective work.
Pretty much. And if something like separation anxiety is suspected, video recording the dog while the owner's away is incredibly revealing. You can see the stress levels, the pacing, the vocalizing, and the elimination.
Okay, so once you have a diagnosis, or at least a strong suspicion of the cause, what are the general principles for treatment? It can't be one size fits all, right?
Definitely not. The treatment plan has to be tailored to the specific underlying cause. But there are some general guidelines that apply in most cases.
Like what?
First, obviously, if there's a medical condition that needs direct treatment. Same if there are other behavioral issues like significant anxiety, those need addressing too.
Right.
Client education is also huge. Owners need to really understand why it's happening and what's involved in managing it long term. It's often not a quick fix.
Patience is key, I imagine.
Very much so. Consistent and correct house training techniques are often part of the plan, even for older dogs who might need a refresher or never quite got it right. And it's really, really important to thoroughly clean any soiled areas with a special enzymatic cleaner. Regular household cleaners often don't cut it. They might mask the smell for us, but not for the dog's sensitive nose.
Right, leaving that scent cue that says, go here again.
Exactly. You have to break that cycle.
What about punishment? I know it's a natural sort of frustrated reaction for some owners, but is it actually helpful?
Oh, it's strongly discouraged. Punishing a dog for house soiling, like rubbing their nose in it, yelling, hitting it, can actually make the problem worse. It increases their anxiety and fear around elimination and around the owner. It doesn't teach them where they should go. Instead, they might just learn to sneak off and hide when they need to eliminate, making it much harder to monitor and manage the issue. Plus, it can damage the human-animal bond.
That's a really crucial point. Fear and anxiety just complicate everything.
Mhm.
Okay, so let's talk specific behavioral issues and treatments. What's the approach for, say, incomplete house training in a younger dog?
Right. For incomplete house training, it's all about consistency and positive reinforcement. Close supervision is key.
Watching them like a hawk.
Pretty much.
Yeah.
If you can't actively watch the puppy, they should be in a crate or a small, confined, safe space where they're less likely to have an accident. Frequent trips outside are essential, especially right after waking up, eating, drinking, or playing. Take them to the same spot in the yard each time. Use a consistent verbal cue like go potty or potty time. And this is critical. Immediately reward them with enthusiastic praise and a high-value treat the second they finish eliminating outside.
Got it. Reinforce the right behavior instantly.
Yes. And feeding them on a regular schedule helps make their elimination times more predictable, too. And again, any indoor accidents, clean thoroughly with that enzymatic cleaner, no scolding.
Okay. What about that submissive or excitement urination? That seems tricky because it's tied so closely to their emotions.
It is tricky. The key here is to try and minimize those really intense emotional responses, especially during greetings.
Like when you first come home.
Exactly. When you arrive home, try to keep your greeting really low-key initially. Avoid direct eye contact, loud, excited talk, or rushing to pet them right away.
That feels unnatural.
I know, but take them straight outside to their potty spot before you engage with them enthusiastically. Then, when you do greet them, do it calmly. Maybe kneel down instead of leaning over them, which can be intimidating. Sometimes, redirecting their attention with a favorite toy or asking for a simple command they know well, like sit, can help sort of break that pattern of excitement or urination, and absolutely never punish them for it. It'll only make the submissive behavior worse.
That makes sense. Manage the trigger situation, the greeting. Now, urine marking. That has to be one of the most frustrating ones for owners. What are the strategies there?
Yeah, marking can be tough. One of the most impactful interventions, especially with intact male dogs, is neutering.
Right. We mentioned the stats earlier.
Yeah, the studies show neutering leads to a rapid decrease in marking about 30% of male dogs, a gradual decrease in another 20%, though about 50% show no change specifically related to marking after neutering, regardless of the age it's done. Still, it often helps.
Okay, so neutering is a major consideration. What else?
Beyond that, you need to play detective again. Try to figure out what might be triggering the marking. Are there new animals outside the window? Changes in the household routine? New furniture? Addressing those underlying anxieties or territorial concerns is key. Things like desensitization, gradually exposing them to the trigger at a low intensity where they don't react, and pairing it with positive things or counter-conditioning, changing their emotional response from anxious to relaxed around the trigger, can be really helpful.
So behavior modification techniques.
Yes, and practically, limiting their access to areas they frequently mark is important. Close doors, use baby gates. Making those marked spots less appealing can also work. Try placing unpleasant textures like upside-down carpet runners with the knobby bits up, or aluminum foil.
Foil, really?
Yeah, some dogs hate the feel and sound. And interestingly, sometimes changing the association of a marked spot to something positive, like feeding them their meals right there or playing with them there, can disrupt the marking behavior in that specific location.
Turning the no-go zone into a good things happen here zone. That's clever. What about medical or surgical interventions beyond just treating underlying conditions?
Well, we just covered the surgical aspect with neutering and its potential impact on marking. When it comes to medications for house soiling or marking that's clearly linked to significant anxiety, like separation anxiety, vets might consider prescribing psychotropic medications.
Like antidepressants for dogs?
Essentially, yes. Things like SSRIs, such as fluoxetine, or TCAs, like clomipramine. But, and this is absolutely crucial, these medications are most effective when used in conjunction with a solid behavioral modification plan. They are not a magic bullet or a standalone cure.
Right. Meds support the training.
Exactly. They can help lower the dog's anxiety enough so that the behavior modification can actually work. It usually takes several weeks, maybe 4 to 6, to see the full effects.
Okay.
And like any medication, there can be side effects, sometimes digestive upset, maybe lethargy, and certain meds, particularly TCAs, might not be suitable for dogs with a history of seizures or certain heart conditions. So a thorough vet check and discussion is essential.
Are there other options besides prescription meds?
Yeah, some people explore other options. Pheromone products, like sprays or diffusers designed to have a calming effect, can be helpful for some dogs with mild anxiety. And certain nutritional supplements, nutraceuticals, might offer some anxiety support too, though the evidence varies. But again, usually best used alongside behavior modification.
So it sounds like a really integrated approach is often needed. Behavior training, maybe environmental changes, potentially medication to support that, and sometimes surgical intervention like neutering. How important is follow-up and monitoring progress?
Oh, follow-up is critical. The vet team or behaviorist needs to track how the dog is doing and whether the treatment plan is actually working or if it needs adjusting.
How does that usually happen?
It often involves scheduled checkup appointments or maybe just phone calls or email check-ins with the owner. Keeping that detailed log or journal we talked about, noting accidents, potential triggers, what interventions are being used, provides invaluable information for tweaking the plan as needed. Progress often isn't linear.
Good point. And looking ahead, what can new dog owners, or maybe people who haven't faced this yet, do to prevent house soiling from becoming a problem in the first place? Any prevention tips?
Yeah, prevention really starts with setting the dog up for success right from the beginning. Thorough, patient, and consistent house training, starting as early as possible, is number one.
Hmm.
Neutering your dog, whether male or female, can significantly reduce the likelihood of hormone-driven urine marking later on.
Okay.
And just being proactive about addressing any early signs of anxiety or other behavioral issues. Don't just hope they'll grow out of it. Early intervention can prevent things from escalating into house soiling problems down the road.
And regular vet visits too, I guess.
Absolutely. Regular veterinary checkups are key for catching any underlying medical issues in their early stages before they potentially lead to changes in elimination habits.
Finally then, what's the overall outlook? For dogs struggling with house soiling, what kind of prognosis can owners realistically expect?
Well, the prognosis really depends heavily on the owner's commitment and consistency in following the recommended treatment plan. That's probably the biggest factor.
Makes sense. It takes work.
It does. But for things like submissive and excitement urination, we generally see a good rate of improvement with consistent management of greetings and triggers. Similarly, with proper positive house training techniques, the outlook for resolving incomplete house training is also generally good, especially in younger dogs.
Okay.
As we mentioned, neutering can have a significant positive impact on marking in many intact male dogs. Even for spayed or neutered dogs that mark, if the triggers can be identified and managed effectively through behavior modification and environmental changes, the prognosis for improvement is often quite good.
That's encouraging. Any caveats?
Just the point we touched on earlier,
Yeah.
sometimes even after successfully treating a medical condition that caused the house soiling initially, the habit of eliminating indoors might unfortunately persist. It can become learned behavior, and that might require additional specific behavioral work to resolve.
Right. Breaking the habit itself. Okay, let's try and bring this all together one last time then.
Yeah.
Canine house soiling. It's clearly not just about a dog being bad or disobedient.
Not at all.
It's a complex issue. It has this wide range of potential causes, both behavioral and medical. And I think the big takeaway here is that punishment is definitely not the answer.
Right. It can make things worse.
Yeah. What's really needed is a careful look at the possible underlying reasons. Is it medical? Get veterinary treatment. If it's behavioral, that needs consistent, positive training and management, maybe environmental changes.
Precisely. And working closely with your veterinarian and potentially a certified veterinary behaviorist, if needed, to get a tailored diagnosis and treatment plan that really is the most effective path forward for both you and your dog.
This has been a really helpful deep dive into a topic that, well, it affects so many dog owners. It's a good reminder that our dogs communicate with us in lots of ways. And sometimes what looks like a simple accident actually has a much more complex story behind it.
Very true.
So here's something to think about as we wrap up. Given how closely a dog's elimination habits are linked to their physical health, their emotional state, and even our own routines and responses, what's maybe one small adjustment you could make in how you observe your dog or how you manage their environment? That might offer a new clue or perhaps a potential solution if you're facing any indoor elimination issues. Definitely worth a moment of reflection. Thanks for joining us for this deep dive.